take a wine. Move to the right and take a wine. Move to the left, take a wine. Move to the right and take a wine. आजा देखो मैंने देखा है ये एक सपना फूलों के शहर में है घर अपना क्या समा है तू कहाँ है आई 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 आजा कितना हंसी है ये एक सपना फूलों के शहर में है घर अपना क्या समा है तू कहाँ है आया 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 आजा move to the left and take a wine move to the right and take a wine move to the left and take a wine move to the right and take a wine यहाँ तेरा मेरा नाम लिखा है रिश्ता नहीं आप लिखा है यही दरवाजा यहाँ तो खड़ी है अंदर आ जाओ सदरी बड़ी है यहाँ से नजारा देखो पर्वतों का झांकुम कहाँ से कहाँ है जरूर का ये यहाँ है तू कहाँ है आई 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 आजा कितना हंसी है ये एक सपना फूलों के शहर में है घर अपना क्या समा है तू कहाँ है आया 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 आजा move to the left and take a wine move to the right and take a wine move to the left and take a wine move to the right and take a wine अच्छा ये बताओ कहाँ पे है पानी बाहर बह रहा है झरना दीवानी बिजली नहीं है यही एक गम है तेरी बिंदिया क्या बिजली से कम है छोड़ो मत छेड़ो बाजार जाओ जाता हो जा
A very pleasant good afternoon and welcome to the Ken Rampersaud Show on Island Zone Radio on this cold Sunday afternoon.
आजा देखो मैंने देखा है ये एक सपना फूलों के शहर में है घर अपना क्या समा है तू कहाँ है आई 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 आजा कितना हंसी है ये एक सपना फूलों के शहर में है घर अपना क्या समा है तू कहाँ है आया 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 आजा move to the left and take a wine move to the right and take a wine move to the left and take a wine move to the right and take a wine
Well, a very pleasant good afternoon and welcome to the Ken Rampersaud Show on Island Zone Radio here on this cold Sunday afternoon. Um, it's very cold here in New York for the past couple of days that we have been here. Lord Jesus, I could feel the coldness in my bone this morning as I was waking up. So I hear TV somewhere around, so I'm going to ask they take the TV off. Um, so again, welcome to the Ken Rampersaud Show today. Today I wanted to talk about cervical cancer, and the truth of the matter is, before I know that the seriousness of cervical cancer, I want to talk a little bit about the HPV virus. And a lot of times, people, when I say the HPV virus, people really don't know what we are talking about. And so, since there is a relationship between cervical cancer and the HPV virus, I thought to myself, let me start today's show with let's talk a little bit about the HPV virus. Last week I had the flu last week, and I tell you, with the cold and the cough and everything, I'm now getting over that, and so I Just forgive me if you hear me coughing, all right? The important thing is that you get some vital and important information, especially for women. The human papilloma virus is the most common sexually transmitted disease in the United States of America. And the HPV virus estimates that there are 43 million people with infection in 2018. In the same year, there were 13 million new infection. So this is growing very rapidly. HPV virus is common and mostly ever sexually active person. So if you're sexually active, and I'm going to say this later on in the in the show, if you're sexually active some way down the line, you will get this virus somehow or the other. But I have good news for you. And I know that some way down the line, years to come, we will see the results because there is a vaccine that's out now for the for the kids, for the boys and the girls. We will talk more about that. And so with health problems related to the HPV, um, includes vaginal, genital warts and cervical cancer. So that's two things we're going to talk about today: the genital warts and the cervical cancer. Um, and when we talk about the genital warts, what we're talking about, um, prior to HPV vaccine, genital warts caused by the HPV affect roughly 340,000 to 360,000 people yearly, and that's a lot. About 1 in 100 sexually active adults in the United States has genital warts at any given time. And I will tell you what that looks like later on. Cervical cancer: every year, nearly 12,000 women living in the United States will have cervical cancer. More than 4,000 women die from cervical cancer, even when screening and treatment is done. So, what can we really do? What is this HPV virus that we don't know about? And a lot of people don't know. Some people have never seen it. As a nurse, I can tell you, back in the days, I had the opportunity to see a lot of things. And one of the things that I was able to witness is what the warts look like. I remember having two or three patients with warts, and I'll tell you the story a little bit. And I really didn't know much about it either. Although I was a nurse in Guyana, I've never seen what it looks like. But when I came here as a nurse, when I started to work as a nurse's aide, I was able to see, witness, and see what this looks like, right? um, there are, let's see, you can get HPV virus, and listen carefully how you could get it. You can get HPV virus by having vaginal, anal, or oral sex with someone who has the virus. It is most commonly spread during vaginal and anal sex. It's also spread through skin to skin contact touching during sex. A person with HPV can pass the infection to someone even when they have no sign and symptoms. If you're sexually active, you can get HPV virus easily if the other person has it. Even if you have had sex with only one person in your lifetime and that person have it, guess what? You can get it too. You also can develop symptoms years after having sex with someone who has the infection. This makes it hard to know when you first got it. So I'm going to tell you this couple things that we know about this. You can get infected with the HPV virus today, and you may not know that you get it. Sometimes it would take 6 months. Sometimes it would take 5 years. Sometimes it could take 10 years. And guess what? Sometimes you may never know that you have the HPV virus. And what will happen is that every time you go and have sex with someone, most likely that person will develop the HPV virus, right? And we know that it's caused by skin to skin contact, okay? Um, And does HPV virus cause cancer? As we talked before, it does. HPV can cause cervical and other cancers, including cancer of the vulva, and that's in a woman, the vagina, the penis, or the anus. It can also cause cancer in the back of the throat. Um, this can include the base of the tongue and the tonsils. Cancer often take years, even decades, to develop after a person gets the HPV virus. Genital warts and cancer result from different types of the HPV. People with weak immune system may be less able to fight off the HPV. They may also be more likely to develop problem with the HPV. And I want to say not everybody who gets the HPV would develop cancer. As I want to tell people all the time, we are individuals, and so what may affect you may not affect me. What may affect me may not affect you. So I want us to understand that, and not because you see that you get HPV virus, that means that you're gonna get cancer. Okay, I just want to make that very clear. How can I avoid HPV virus, right? And the health problems that it may cause? You can do several things to lower your chances of getting the HP virus. One, that we are lucky that some years now that they get the HPV virus vaccine, I think it's the Gardasil, they get the vaccine, you get vaccinated, you make sure that your young girls and your young boys get it. We're going to hit the age group not too long from now. So make sure, and it's a good thing to do. You have your children 12, 13 years old, boys and girls, let them get the vaccine. Just like the vaccine for different things, they have developed this vaccine for the HP virus, right? Um, Also, get vaccinated. The HPV virus is safe. I want to tell you, studies have shown that it's safe and it's effective. Effective, right? It can protect against disease, including cancers caused by the HP virus. When given in the recommended age group, get screened for cervical cancer. Routine screening for women aged 20 to 65 years can prevent cervical cancer. Also, if you are sexually active, use condom every time you have sex, and and you want to use the right condom. Those that are good, not the cheap one that probably will break. This can also lower your chance of getting the HP virus. But HP virus can infect areas that the condom does not touch, and we will talk a little bit about that in a minute. So the condom may not fully protect you against the virus, but in a mature, but be in a mutually um, monogamous relationship or have sex only with one person who only has sex with you. So it's good to use a condom when you're having sex. It's one of the best things you can do. Also, as we talk about, it go from skin to skin. So you never know if the genital area you have the virus, could be the pubic area, you have the warts or the HP virus, and you go with someone else, they can get that virus. So don't think that because you use the condom, but yes, it's a good thing to do, and not only that, only virus that you're gonna um, not that's the only one that you're gonna prevent. You got different form of STDs. Probably another day I could talk about about the STD, different STDs. All right. Um, I see we have David M. Singh. Good afternoon. The beautiful Miss Ariana V is watching, and she made it. Thank God. To my beautiful aunt Dilari Sigobin is watching from Hartford City, Connecticut. Hey, my big brother, Mr. DJ Harry. DJ, I want to say thank DJ Harry. I want to say thank you so much from the bottom of my heart for, I always listen to your radio when I'm not listening with Gita phone. I listen with my phone, but I come on my phone just to say hello. But I do listen with Gita phone. And so, my brother, I want to say thank you very much to you for always shouting myself and Gita out and for your wonderful comments. It makes a difference when you have the support in people. And you're right, it is some important topic we are talking about here. Camille, kind of very good afternoon to you too. Thank you very much. Anita Ishdaulat Ram is watching from Canada. Thank you very much. Hafiza Khan is watching. Thank you very much. Shasita Singh, good afternoon. Tasha Bridgemohan, a very good afternoon. The beautiful Miss Usha Azimula is watching from Wisconsin. It's cold. So guess what? It's sad. It's so damn cold, and I can only hope that we get a better play. It gets warmer because this is too much. This is going to clear up our bill, our heat bill. All right. Who else do we got? We want to say hello to people that's watching. Um, if I miss out, so DJ Harry, we are talking about about HPV virus. I am not sure if you ever heard of this, and this is commonly known as the warts, right? Claudette is watching. Thank you very much. Bono Sibaran, no, Reno Sibaran, my good friend, my school days buddy, is watching. He's from Seafield, Lenora on the west coast of Namara, but I think he's living in the Bronx now. Reno, good afternoon, and thank you for watching. Um, like I said before, I had the cough and the flu and everything. My flu is now going away, thank God. The cough is still there, lingering on, and I, I don't know what to do. I'm drinking some chai tea to keep me warm. All right. So today we are talking about my important topic today is about the cervical cancer, but I want to bring in the HPV virus, the HP virus, because it's kind of related to the cervical cancer. And people don't really realize that this HPV virus is very common. It's very common. You may have it and you don't even know. You may die and you would never know that you had this before, right? Who should get the HPV vaccine, and that's important. And you want to know the Center for Disease Control recommend that the HPV virus vaccination for all preteens, including boys and girls, ages 8, 11 to 12, or they can start as early as 9 years old. Everyone through age 26, if not vaccinated already. Vaccination is not recommended for everyone older than 26 years old. However, some adults age 27 through 45 who are not already vaccinated may decide to get the HPV virus. Vaccines are speaking with you can speak to your healthcare provider about the risk of the HPV infection and the possible infection of the benefits of the the vaccine. So I would recommend you that you get this vaccine. And the other thing is that if you're not sure what to do, always consult with your doctor. Ask your doctor what's the best thing to do, especially if you have a partner who's kind of promiscuous or who goes from one place, or even you who have you change your partner every now and again. Definitely sometime down the road that you may get this. Okay. Um, Also, I want to tell you that let's see. How do I know if I have the HPV virus? And that's a very, very important question. So, like I said, there is no test out for persons with the HIV, with the HPV virus. You don't know. There's no test. Most people with the HPV do not know that they have the infection. They never develop symptoms or any sign or health problem from it. Some people find out that they have HPV when they get genital warts. Women may find out that they have the HPV when they get an abnormal pap smear result during a cervical cancer screening. Other may find out once they develop more serious symptoms from HPV, such as cancer. There are other conditions and cancer caused by the HPV that occur in persons living in the United States. Every year, about 19,400 women and 12,100 men experience cancer caused by the HPV. And that's why I brought this up today to talk about. So, like I said, you may not know that you have this. Like for a guy, you may have sex with someone today and next 6 months. You wake up one morning and you notice there is a growth on your penis, maybe small. Um, I'm going to share this story with you. When I came to the United States first, and that's the first time I get to see what the HP virus is like. So I had this female patient, and I had to wash her up and so on. And so when I when I was going to wash her, I noticed, oh my God, my the hair on my body stand up because the this warts was all over in her private parts, and it looks like cauliflower. You see how cauliflower is? That's exactly how it is. Sometimes you could find it one spot. Sometimes you could find it in different, like one big area with a lot, and sometimes you get a small one. And as I'm talking, as I'm going through, I'm sharing with you guys that you go to your doctor, there is thing that they could cut it out, or they could burn it out. And sometimes when they do that, um, you never get you would never get it back again. You will never see any warts come back again. But I want to tell you that I have seen, well, patients probably don't know that I know some of them. Not too long ago, I was giving someone their medication, and I noticed when they opened their mouth, I noticed the warts was right inside of their mouth. Um, so you could get it on your mouth, you could get it on your tongue, right, your anus and so on. Okay, women in your vagina area, you could get it, right. So, but it is not something that you should really alarm about, because I want to tell you this one thing, which it may come later on in my notes, that when you have the HPV virus, right, sometimes it goes away by itself after some time. So within a year or 2 year, it may go away. Sometimes you get it, it go away and you don't even know. So I want to tell you and be very careful that you want to make sure that you use your condom, and 100% condom is not 100% that you are going to not get the HPV virus. All right, but it's good. Anytime you go out with somebody for the first or second time, always wear a condom to protect yourself and to protect the other person. All right, and is there treatment for this? And as we said before, there is no treatment for the virus itself. However, there are treatment for the health care, for the health problems of the HP can cause. Genital warts can go away with treatment from your healthcare provider or with prescription medication. If left untreated, warts may go away, or they may stay the same, or they may grow up to the size of take over the whole penis head, or the shaft, or you get it even on your scrotum. All right. So I made that short and sweet for you guys. Um, so couple things before I go on to cervical cancer. I'm going to play a song just now. Just want you to know, a lot of people will get cervical, would get the HP virus. It's passed on from skin to skin. It is not something that you should men especially, you should really worry about, because like I said, it could go away within a year or two. But there is problem if it lingers on in the body and it doesn't go away. Then it could cause cancer of the throat, your tongue, um, different parts of your body. Then it could lead the worst part. You get cervical cancer. So just to let you know, I know sometimes that I don't bring all the hot juicy topics for you guys, but I just want my show to be educational. Things that other people are not talking about, I want to talk about. And because, I've been a nurse for over 30 years and I have experience with a lot of things. I want to share these things with you guys. Um, you know, if you're a layman, some things you may not know about, and these things. And I want to tell people sometimes they go to bars, they go to parties, they meet a guy, they go out, they just have sex, and I want to encourage people to that kind of lifestyle is no good. That you want to make sure that you protect yourself. Um, when you get drunk, you know what you're doing. All right. So I'm gonna play a song now, catch my breath, and then when we come back, we're gonna talk a little bit about cervical cancer, and that's for women. Okay. I think I've touched most people already. Um, hope you guys still locked on. Thank you very much. Let's play another song. One of my favorite songs.
Sajna, oh Sajna,
Please share it for your friends and your family.
तुझसे प्यार किया तेरा प्यार है दुनिया में
Good afternoon to the beautiful Manila Pawaro. I know it's cold at your end.
तू ना मिला तो मर जाऊंगी साथ रहेगा जन्म जन्म साथ
Good afternoon to Mr. David Singh. How are you, brother?
साथ ना
The
छूटे
beautiful Geeta Rampersad is watching.
सजना ओ सजना मैंने तुझसे प्यार किया 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 मैंने तुझसे
Welcome back to the Ken Rampersaud Show that airs every Sunday afternoon from 5 p.m. to 7 p.m. But sometimes I do finish early based on the information that I want to share with you guys. So I see we have Neela Porau. Good evening, Neela. Um, we have page 1T Prasad. A very good afternoon to you. Thanks for tuning. And Claudette Prash, a very good afternoon to you. And yes, when we get this information, we can pass it on to our children. And I think that, in this generation now, back in our days, our parents didn't talk nothing about sex, about STDs and all these kind of things. But I think in this age and time, that we need to have these discussions with our children, especially with our young boys and girls, of some of the dangers that's out there and what they could do to protect themselves. Because now is a different time, not like long time. And it's good that we have these kind of conversations. So don't be shy to talk about your children, to talk with your children about STDs and pregnancies and all these kind of things. All right. um, I also want to say a special thank you to DJ Hurricane from Toronto, Canada, for always bigging up me and for always sharing my show and for, you know, to mention it on his radio show and encourage his viewers to watch my show. Let's talk about the beautiful Nadia. I wonder if I said hello to Nadia from Barbados, Nadia Mulchin. She is a registered nurse also. She is a midwife in Barbados. And I was wondering to know, as a nurse, wonder what's her take with the HP virus, especially in probably Barbados. How much mothers she have seen having the HP virus. Nandalal, a very good evening to you. Thank you very much. Um, so let's talk a little bit today. Today we talk about one thing already. We talk about the HP virus. Now we're going to talk about cervical cancer. My main topic today is cervical cancer, but I just brought in the HP virus because there's a relationship, and I see that later on down the line you will see how the HP virus interrelated. An estimated of 604, 127 women were diagnosed with cervical cancer in 2020. Cervical cancer is most often diagnosed between the age of um, 35 and 44. The average age of diagnosis in the United States, it's about 50. Over 20% of cervical cancer are diagnosed after the age of 65. These cases usually occur in people who did not receive a regular cervical cancer screening before the age of 65. In rare cases, for people younger than 20 to develop this form of cancer. So it is rare for people who are 20 years old and younger to have cervical cancer, right? And I want to say that I should have earlier let you know. I should have put up the picture up on but it's too late for me to do that now. Probably tomorrow, if I get time, I can do it to let you see what the cervix look like. um, I wonder if when I play a song, I'll try to do it anyway, so we could get a talk about it a little bit. Now, what is cervical cancer? Cervical cancer is cancer that starts in the cells of the cervix. The cervix is the lower, narrow end of the uterus, which is we call the womb. The cervix connects the uterus to the vagina, which is the birth canal, right? Um, cervical cancer usually develop very slowly, and it takes time over time before cancer appear in the cervix. The cells of the cervix go through changes known as dysplasia, in which abnormal cells begins to appear in the cervical tissue. Over time, if not destroyed or removed, the abnormal cells may become cancer cells and start to grow and spread more deeply into the cervix and in surrounding areas. And it's here where we talk about, and I'm going to try see if I could pull it up. When we talk about surrounding areas, we could go to the uterus, it could go to the fallopian tube, different parts in the pelvic area, in the pelvic too area, you could get cancer. So in different parts, and one of the things that you don't want to do if you start to get signs and symptoms, you need to get it checked out, right? And we know that there are three types of cervical cancer that can exist in more than one form, including squamous cell. And I'm just mentioning this to you guys just for the information's sake. Squamous cell carcinoma, this form in the lining of the cervix and is found into 90% of the case. Adenocarcinoma, this forms in the cells that produce mucus. And mixed carcinoma, this has features of both types. Okay. Pearl, a very good evening to you and thank you for tuning in. So, what caused cervical cancer? Um, cervical cancer begins with unusual changes in your tissue. Most cases are linked to infection with the HP virus. See, different types of HP virus can cause skin warts, genital warts, and other skin disorder. Others are linked to cancer involving the vulva, the vagina, the penis, the anus, the tongue, and the tonsils. For the past, like I came from Guyana probably about 40 years with a little wart on my hand, but we're not talking about this one. This is not sexually transmitted, and this one is not this one is not very contagious, right? um, so most people who are sexually active will get infected with the HPV virus. Um, and I told you before earlier that it goes away on its own sometimes, but if the infection doesn't go away, it can lead to cervical cancer, right? And most people who are sexually active, sometime or the other, that's what people who sleep around that they can get it. You know what I'm saying? It's like if you go in the crab dance, you will get mess, right? Um, let's talk a little bit about the risk factors of cervical cancer. You might be at higher risk for cervical cancer if you start having sex before age 18 or within a year of start your period, having multiple sexual partners, which increase your exposure to HP virus, and if you're taking birth control pill, especially for longer than 5 years. Also, if you're smoking cigarettes, have a weak immune system, so your body is less able to fight infection. and if you, and that's why it's important, and that's why it's important that I also try to build my immune system. And I probably will need to do a show of some of the food and some of the things that we could do to build our immune system. Because for me, to be very honest with you, excuse me, every time the cold pass, I get it. Every time the coughing come, I get it. So it's important that we build our immune system so that your body will be able to fight infection. Having a sexually transmitted disease, um, haven't been vaccinated against the HPV virus, and that's why there's a virus, there is a vaccine that's out for children, right? Young girls and young boys. They could start to get it even as age 9, okay, upward. Um, Also, haven't been vaccinated against HPV virus, have 3 or more pregnancies, were exposed in the womb because there is a medication, the DES, and that's a drug that was given to people, women, between 1948 and 1971 to prevent miscarriages. That's a long time ago story. Are rare risk factors. Also, those who are obese, which may make it harder to diagnose cervical cancer, right? Have a low income. And why I say having a low income, and we may ask, why are we talking about a low income, right? Because sometimes people with low income does not really have health insurance, um, and they may not have means to go out and get regular checkup that they need to do often. So those are some of the people who can get it. Um, let's talk a little bit about some symptoms of cervical cancer. You may not notice symptoms of cervical cancer until guess when? It's far too gone. When it's stage 3 cancer or stage 4 cancer. That's the time you may know, and that's a sad part of it. But if you pay attention to your body, and for men, sometimes we don't, we pay attention, but guess what? We don't like to go to the doctor. You may, like I said, you may notice or not notice any sign of cervical cancer until it's far too gone, and that goes for a lot of cancer. Early signs of cervical cancer include pain when you're having sex, unusual vaginal bleeding, and you should, as women, you should know your body, such as after sex, between period, after menopause, or after having a pelvic examination. Unusual vaginal discharge that is watery, bloody, and or has a strong odor. And I have to tell you, if you notice, if you observe that your private part for women, if you're having a strong odor that's coming there, or if you're having any kind of discharge that's smelly, bloody, or watery, guess what? You need to check out with a doctor. After he spread the cancer, it could cause pelvic pain, and that's your pelvic area, trouble peeing, swollen legs, kidney failure, and that's way after. Back bone, weight loss, um, bone pain, I mean, weight loss, and lack of appetite, fatigue, backache, stomach pain, right? And you want to know, when do you really, when you go to the doctor, when do you make up your mind and says, listen, it's high time that I go to the doctor now? Bleeding after menopause is never normal, and that goes for the older woman, right? So talk to your doctor as soon as possible. Tell your doctor if you are having any heavy periods or after bleed between the periods. Some women have bleeding after vigorous sex, and it's probably nothing to worry about. But sometimes men feel that they could beat up everything, right? Um, Damage up things. So, but the truth of the matter is, if you get a little bleeding after sex, probably it's not too bad. But keep an eye on it and watching. Okay. Thank you, Henry Villa, watching all the way from Irving, Texas. I heard it's cold there. um, Dolly Pulmati, a very good evening to you. Thank you very much. I'm trying to get better. um, Kavitabu, good night. Thank you very much for your love and your support. Always positive. um, Also, you go to the emergency room if you're vaginal bleeding along, you get some weakness, or if you faint, lightheaded, or you pass out. And anytime you're having bleeding, it's never a good thing. Your HB count can go down, so you want to check it out for women, especially. Okay, and we could talk a little bit about the risk factors. We've touched on that some of that later. Let's talk about some people smoke and they don't know. Smoking increases the risk of cervical cancer. Also, we know that we're going to keep the focus on cervical cancer, but we also know that cigarette cause cigarette smoking cause cancer of different parts of your body, especially your lungs. When HPV virus happens in people who smoke, the infection tends to take longer and are less likely to go away. HPV virus cause most cervical cancer. Increased number of sexual partners. The greater your numbers of sexual partners, and the greater your partner numbers of sexual partners, the greater chance of you getting the HPV virus. Early sexual activities. Having sex at an early age increase your risk of having the HPV virus because we know you start having sex early. You may go down the line, you may change three, four partner, five partner, some people 10. It all depends. All right. um, Also, other sexual transmitted infection, having other sexual transmitted infection, also called STIs, increase the risk of HPV, which can lead to cervical cancer, as we said before. Other STI which increase the risk, including herpes, chlamydia, gonorrhea, syphilis, HIV, and AIDS. The good thing now with HIV/AIDS is that it's something like it's treatable. They put you on a tablet once a day, and you can live 20, 30 years after that. Okay, so years ago we used to worry about AIDS. Not no more. Not no more. Years when I started nursing in 1993, there was a ward, a special unit, where we had cancer patient with HIV/AIDS. Not no more. Now you don't know who have it or who have it. A weak immune system. You may be more likely to develop cervical cancer if your immune system is weakened by other health conditions and you have HPV. Exposure to miscarriage prevention medication. If your parents took the medication, and I tell you, it's a long medication name. I first time I'm seeing this anyway, but the short name is DES. It's diltiazem, and a short name, while you were pregnant earlier before 1971. Your risk for cervical cancer might be increased, which we have spoke about earlier. This medicine was used in the 50s and like 60s and so on to prevent miscarriages. It's linked to a type of cervical cancer that's called clear cell adenocarcinoma. And how do we really prevent this? To prevent our women risk for cervical cancer. Ask your doctor about the HPV vaccine. Reduce receiving a vaccination to prevent HPV virus infection may reduce your risk of cervical cancer and other HP related cancer. And ask your healthcare team if an HPV vaccine is right for you. Have routine pap smear tests, and I know that get it done routinely, right? Um, and most women should do um, the pap smear test. Pap smear test can detect precancerous condition of the cervix. These conditions can be monitored or treated in order to prevent cervical cancer. Most medical organizations suggest begin pap smear test at the age of 21 and repeating them every few years. And the best thing to do, talk to your doctor about these things, especially if you're sexually active and you're changing partner from, every couple of months you change a partner. You may want to check that. Oh, my beautiful friend, Miss Avita Danraj, is watching all the way from um, Canada. Thank you very much for watching, my dear. Hope all is well with you. I miss chatting with you. Hope things are going well at your end. Pearl Befina, a very good night to you. Thank you very much. Joni Mahobir, a very good afternoon to you. Rabindra Prashad, a very good afternoon to you. Thanks to all of you for watching. So we want to encourage women, get that pap smear. That pap smear will tell a lot of things. Practice safe sex. Reduce your risk for cervical cancer by taking measures to prevent sexually transmitted infection. This may include using a condom every time you have sex and limiting the number of sexual partners that you have. So, like I said, make sure that you wear your condom again with the HPV virus because it's skin to skin. If you have it, most likely you would give it to your partner or the person who you have sex with. And yes, you could get HPV virus from oral sex, right? Sorry about that. Also, don't smoke. If you don't smoke, please, children, don't start smoking. It's expensive too, and it could be very dangerous for your health. If you do smoke, take um, talk to your healthcare professional. Let they give you. There is so much things out there that you can use. You got cigarette patch. You have cigarette. You have the gum that you could chew. And if you need any kind of information about these things that we're talking about today, don't hesitate to text me or write me. I may not have all your answers, but I could probably lead you to the right place to get the right answers. Right? Let's talk about cervical cancer screening. Screening tests for cervical cancer include, we know, the pap smear and the HPDNA test, right? Pap smear is a part of the woman regular physical examination. Your doctor collects cells from the surface of your cervix, and a technician looks to them under a microscope. If they spot anything unusual, they will do a biopsy. And as we talk about biopsy, biopsy is just going to your cervix area. They're gonna snip a piece of your flesh, and that's what's called biopsy. It's not that painful. And they're going to send it for the technicians to look at it and see what's going on there. Your doctor takes cells from your cervix and the technician look at them, yes, to see if they're infected and any of the types of HP that may lead to cervical cancer. The DNA test may be done at the same time, both of them, as pap smear or afterward, in case of the pap smear test results. And I want to talk to you about sometimes when we don't know about things, we get worried, we get scared. Um, some of the tests that's done, we spoke about, and I'm going to run it back again with you so you could know when you hear these things, your doctor talk about it. You can always say, I heard it on the Ken Rampersaud Show. Pap smear, that's one. That's common test. Cells from the cervix are taken and examined in a lab for any kind of abnormal cells. An X-ray is taken to see if the cancer has spread beyond the cervix, like the fallopian tube, the uterus, the pelvic area. We also do a CT scan of the cervix, provides a detailed image to identify the severity of the cancer. And we have the HPV DNA tests, cell taken from the cervix are checked for HPV infections, and then we have the cone biopsy. And to be honest with you, I didn't know about the cone biopsy. I've never seen it done. It's, examination of the cervix by a magnifying instrument called the colposcope. The colposcope. Cervical tissue. Then we have the punch biopsy. Right, cervical tissue is scraped by a scalpel tool and is examined in the lab. Then we have the endocervical curettage. Use a small something like like a spoon, and it scrape the inside. And I'm going to talk a little bit about that. And they're going to send those tissues to the lab. Like when they said the DNC, dilatage and curettage, when they go in the cervix, and people hear about when you talk about clean out in Guyana, where they go, they take that thing like the spoon and they scrape your inside out, the inside of your uterus, right? Endocervical curettage, we talk about that. The MRI, and a lot of people believe in the MRI. And one of the things is that people, it's good to have an MRI. That's one of the sure thing you can do. MRI of the cervix is performed to identify the extent of cancer spread. So that's a good thing. The PET scan, a PET scan is is a functional test that shows areas where there is active growth of the tumor. This is particularly helpful when it comes to evaluating lymph nodes, the lungs, and the liver. And we don't want this thing to really metastasize, to go to different parts of your body, to different parts of your body. You don't want your cancer to spread to different parts. The earlier you catch it, it's best for you. Then, it's always, I put cervical cancer, the outlook. How do we look at it? Cervical cancer is a slow growing cancer, right? When caught early, cervical cancer, that it's confined to the cervix, that means it's just there to the cervix. And I'm going to give my little thing on that. Has a 5 year relative survival rate of 92%, which is very high. And that is good. When it just confined just to the cervix, right? Now, after spreading to nearby organs and tissues or lymph nodes or to the specific to in this pelvic region, the survival rate drops severely to 59%. So that's why early detection is the key. Though these are just statistics and do not represent individual cases, early detection and treatment are important for survival, which is why regular screening are very important and it's key. Knowing symptoms and going for regular checkups, having regular pap smears. Important, ladies, go have your pap smears and HP tests can help your healthcare provider find any cervical abnormalities and as early as possible. This allows them to monitor you and make treatment recommendations if they progress. With the availability of the HPV virus vaccine, healthcare provider can prevent many cases of cervical cancer. And I can tell you that a lot of children now are getting the HPV virus. I mean the vaccine. A lot of children getting it, and I do strongly recommend that you get your children, your niece, your nephews, them to go get that vaccine, especially if they're living in the United States, because you know what? And I'm just being honest. Children in this country are having sex much more earlier than us back in Guyana. Excuse me. Some people wait until they marry and then they have sex. Kids here for 13, 14, 15, 16, 11 years old are having sex. You know. So again, I hope that today's show is a little short, but it might be for an hour. Nevertheless, I hope it helps. And I said, do I need a pap smear? A pap smear is done only for ladies, right? How often do you get a pap smear? And this is what I came up with. It all depends on your age, your medical history, and the results of the pap smear or the HP virus in general. If you are 21 years old, you can choose to get a pap smear test every 3 years. Listen carefully. Or you can wait until you are 25 years old um, to start getting tested. But I think that if you start having sexual relationship at a young age with different partners, then you probably need to go and get your pap smear done earlier, right? But if you're with one person, you probably don't need to worry and go do it every couple of years. If you are 25 years to 65 years old, get the HPV test every 5 years. See this every 5 years, which is a long time because, like I said, the cervical cancer it grows very slowly. Um, get or you get a pap smear test together with the co-testing every 5 years in some place where the HP virus tests are not available. You may do a pap smear test every 3 years. If you're older or 65, you may not need to get a pap smear or a HPV test done. You may need to get tests more often if you have problem with your cervix before. But listen, 65 years old, I don't think a lot of people at that age they're doing a lot of stuff, having a lot of sex, so they may not need to do all of that. Okay. Also, if your mother took that, remember we talked about that medication years ago in 1965 and before 70. you may need to get that done. Your doctor or nurse can tell you which tests you need to get and how often you need to do it. Somebody asked me, Ken, do you think about getting the second opinion? I encourage people, I encourage everyone that you should really go and get a second opinion if you if you feel that you need a second opinion. If you have a good doctor, you may not need to go and get a second opinion, right? um, and your doctor who you trust, you may not need to get on. But if you got any inclination that you need a second opinion, then I suggest that you go and do that. But if you're having all kind of symptoms and sign, I would support you to go and you get this done. So again, today show is done in 1 hour. I'm not too well, the cough and the flu and everything else. I'm gonna play one more song for you guys, and after that song, we're gonna go until tomorrow night. You can tune in to From Our Hearts with Radica and Ken, right here on Island Zone Radio. Have a good night, everyone.
ये लो कागज ये लो कलम दिल पे मेरे लिख दो सनम ये लो कागज ये लो कलम दिल पे मेरे लिख दो सनम.
And guess what? On the 11th, I think I'll be interviewing both of these singers. They will be in the studio
प्यार है
along with Mr. Suraj Paul.
तुमको हमसे प्यार है कि तुमको हमसे प्यार है.
अरे छोरो 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 कागज छोरो कलम मेरे लहू से लिख लो सनम. छोरो कागज छोरो कलम मेरे लहू से लिख लो सनम. हाँ हमको तुमसे प्यार है, हाँ हमको तुमसे प्यार है, हाँ हमको तुमसे प्यार है, हाँ हमको तुमसे प्यार है.
अरे ओए 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 ये लो कागज ये लो कलम.
अरे छोरो कागज छोरो कलम. Oh baby will you be mine forever? I need you right by my side. What is life without you if you're not here right next to me? अगर हम तुमसे दूर जाए पर लौट न चाहे पर लौट न पाए तो क्या भूल जाओगी याद तक ना आओगी.
अरे ऐसी बातें क्यों करते हो मुझे धरा कर क्यों हंसते हो क्या रुलाना ठीक है यूं सताना ठीक है.
तुम तो पागल हो गई हो मैं तो यूं ही झूठी बातें बोल बैठा.
अरे छोड़ो 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 कागज छोड़ो कलम छोड़ो कागज छोड़ो कलम.
Imperial Innovation, it's Charmella.
And your boys the little
तेरी
कर दूंगा नाम अपना तुझको देखे
A very pleasant good evening to Miss Naya and Chuni Lal watching all the way from Essequibo Coast.
इस ज़मीं से आसमां तक तू है मेरा 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 उस जहां तक
ओए झूठी
The man, Mr. Vishnu Mahadeo, if you need any healthcare needs for your older family members, contact him. He can put the number right in the shout box.
लो कागज़ ये लो कलम दिल पे मेरे
That's the man, Mr. Vishnu Mahadeo.
तुमको हमसे प्यार है तुमको हमसे प्यार
With the CPAP program here in New York, contact Mr. Vishnu Mahadeo.
तुमको हमसे प्यार है
अरे छोरो छोरो छोरो
Hi, Judy Prasad. A very good evening to you.
मेरे लहू से लिख लो सनम Oh baby will you be mine forever I need you right by my side What is life without you if you're not here right next to me
That's right. You're watching from the Ken Rampersaud Show right here on Island Zone Radio. And this show is every most Sunday afternoon from 5 to 7 p.m. But today we finish early. We talk about two subject areas. We talk about the HPV virus and we talk about cervical cancer. If you didn't get to watch the show today, please share it with your friends and your family so that they could get to watch it and get a little insight of what this is all about. And keep yourself warm until tomorrow evening. Please tune in again to us from our Hearts Radio Ken on Island Zone Radio. Have a good night, everyone, and stay safe.